Did you know that mastitis is one of the main causes of loss in milk production in the world? Today we will reveal everything about this disease, what it is, how to identify, treat, and prevent it. Get ready to understand mastitis like never before. Mastitis is an inflammation of the mammary gland, usually caused by bacterial infections, but can also be caused by fungi and viruses. This inflammation compromises both the health of the cow and the quality of the milk. According to a study published in the Journal of Dairy Science, 2023, mastitis is responsible for approximately 70% of economic losses in the dairy industry due to reduced production and the disposal of contaminated milk. Classification of mastitis. Clinical mastitis. Visible signs such as swelling, redness, heat, and abnormal secretions. Subclinical mastitis. Asymptomatic. Detected only by laboratory tests, such as the CMT, California mastitis test. Clinical mastitis is easier to identify, but subclinical mastitis is even more dangerous because it goes unnoticed and spreads quickly throughout the herd. Main causes and risk factors. Infectious agents: Staphylococcus aureus, Streptococcus agalactiae, E. coli. Improper management: poor hygiene during milking, use of dirty equipment. Environmental factors: humidity, excessive heat, and dirty bedding. Bacteria are transmitted mainly during milking. Poorly sanitized equipment and lack of care for the environment can create a perfect scenario for the onset of mastitis. Researchers at the University of Wisconsin highlighted that cows kept in highly contaminated environments are 30% more likely to develop mastitis. Clinical signs: swelling of the water, milk with lumps or altered color, fever, and loss of appetite in the cow. Pay attention to signs such as hardening of the water and changes in the milk. If you notice anything different, seek help from a veterinarian immediately. Diagnosis. CMT is one of the simplest and most effective tools for detecting subclinical mastitis. In addition, laboratory tests such as bacterial culture help identify the agent causing the infection. Periodically perform tests on the entire herd to avoid surprises. Treatment and the treatment of mastitis depends on the causative agent. Antibiotics are the main choice for bacterial infections, but remember, it is essential to follow the veterinary prescription and respect the withdrawal period of the medication. A study by the International Dairy Federation highlights that the indiscriminate use of antibiotics can lead to the development of resistant bacteria. Prevention. Perform hygienic milking with clean equipment. Ensure the health and comfort of the cows. Implement a drying program with antibiotics. Prevention is always the best solution. Invest in good management practices and keep the herd under regular veterinary supervision. Economic and animal health impacts. Mastitis directly affects productivity and milk quality. In addition, cows with mastitis suffer from pain and discomfort, which compromises their well-being. According to the FAO, Food and Agriculture Organization of the United Nations, the costs of mastitis can exceed $200 per cow annually on high-production farms. Now that you know everything about bovine mastitis, how about reviewing the care on your farm? Remember, the health of the herd directly reflects the success of production. Subscribe to our channel, leave a comment, like, and share this video with other producers. See you at the next Vet News.